for Disease Control and Prevention. I'm delighted to be able to join everyone today to talk about where we are with respect to COVID-19 across the state of Maine for today, Thursday, February 11th, 2021. Right now in Maine, there are a total of 42,058 cases of COVID-19, representing an increase of 175 cases since yesterday. Of those cases, 33,576 are confirmed, 8,482 are probable cases. Since we began our work around COVID-19, 1,464 people have been hospitalized. And right now in Maine, 100 people are in the hospital. 22 of them are in critical care, and 11 of them are on a ventilator. Sadly, since the beginning of the pandemic, 641 Maine people have died with COVID-19. Our positivity rate in Maine has thankfully come down. Right now, our PCR positivity rate on a 7-day basis stands at 2.1%, with a testing volume of 600 tests for every 100,000 people. This decrease in our PCR, as well as maintaining a strong volume of testing, gives us a good degree of insight into where we think the pandemic in Maine is right now. And the trends we've seen mirror what we've seen in other states, which is to say, good signs that there is less transmission of the virus happening right now. As we're going to talk about in a minute, there are still concerning signs on the horizon, particularly with the introduction of new variants. And we'll talk about that in just a moment. Turning now to vaccines and vaccinations. Let's first start with the numbers. Cumulatively, there have been 215,892 doses of COVID-19 vaccine administered in Maine so far. Of those, 155,872 people have received their first dose. And as of this morning, just over 60,000 people in Maine, 60,020 to be exact, Maine people have received both doses of their COVID-19 vaccine. We're simultaneously planning for next week's vaccination activity. Overall, next week in Maine, we will be receiving 22,475 doses of vaccine. Now, this represents an increase of 1,000 new doses that'll be coming into the state of Maine next week compared to this week. We are, no question about it, excited that the allocations of vaccine that are coming into Maine are going up, not down. Earlier, and when we first started vaccinating folks back in December, the allocations we were receiving were going in the wrong direction. We're pleased to see that those increases are going in the right direction now. Although, even though we welcome an additional 1,000 doses next week as compared to this week, it is important to take a step back and just look at where we are as a state. As of this morning, about 65,000 people who are 70 and over in Maine had received their first shot of vaccine. That represents about a third of all individuals 70 and over in Maine. So while we are thrilled that we're getting an extra 1,000 doses, it's important to keep in mind that we still have about 130,000 people in Maine who are 70 and over who are still waiting to get vaccinated. An additional 70,000 doses, bringing our total next week to 22,000, is definitely welcome. But that gulf, that delta, just shows how much more vaccine we need in the state, and by implication, how severely resource constrained, vaccine supply constrained we remain across the state. Before I turn to some questions, I'd like to take a minute to talk about news that Maine CDC announced yesterday. That is news around the first case of one of the variants of concern of COVID-19 being detected in Maine for the first time. Now, before I get into the questions that I'm sure are on everyone's mind, let me take a step back. With 175 new cases today, a low point, the lowest number we've had since early November, and a positivity rate that also matches where we were in November. And thankfully, no new deaths to report today. With those three factors, and our hospitalization rate coming down, it's easy to be celebratory. This is part of the complexity of a pandemic. The good news doesn't always uniformly offset the concerning news. And that's where we are right now. Although there are some good epidemiological signs on the horizon, we still see concerns simultaneously on the horizon owing to the new variants. Maine has now detected its first case of these new variants. Now, we anticipated finding this variant eventually, and as a result of that anticipation, we're taking deliberate, intentional steps to go out and look for it since it was first described in the United States. We are still, as a public health scientific community, in our early phases of our efforts to understand this and other new variants. What I'd like to do today is to answer some frequently asked questions that have come into us by email or on social media just in the last 24 hours. I do this to share what we know currently. Now, what we know right now, as has been the case with just about everything in the pandemic, is based on the best available scientific evidence right now. That may change as scientific data itself changes and new findings emerge. But what I'd like to do is take a moment to answer some of the most commonly or frequently asked questions that we've seen come to us just in the last 24 hours. And let's first start with the basics. What is a variant? Well, viruses constantly change, and they do so by making small genetic errors as they are replicating, as they are reproducing themselves. Those small genetic errors are what we all commonly know as a mutation. When enough of those errors accumulate and start replicating in greater and greater numbers, scientists call that virus that has that constellation of mutations, they term that to be a variant. Multiple variants of the virus that causes COVID-19 have been documented in the United States, indeed all around the globe throughout this pandemic. Now, I know that when I use words like mutation and variant, it presses all of the scary buttons all at once. But let me reassure everyone, most variants that are out there, and there are hundreds, if not thousands, most of those variants do not change how the virus behaves. Indeed, most of those variants pop up, get characterized by scientists, and then many of them disappear. But in January of this year, in late December and January of this year, one of those variants, a variant that was first described in the United Kingdom, found its way to the United States. Indeed, this was fully anticipated based on how quickly the COVID-19 virus spreads across the globe. So one of the next questions that have come to us is, well, how did Maine CDC find this variant? Well, as I've mentioned, we found it because we thought to look for it. Ever since these variants were first described in the UK, as well as others from South Africa and Brazil, ever since they were first described, we anticipated that they would eventually make their way to the United States and thereafter even into our state. We found this particular variant because we knew to look for it. Not only did we know to look for it, we actually went out and looked for it. When our epidemiologists, our field epidemiologists, were interviewing an individual who had COVID-19, and when we heard about particular signs that suggested that the type of COVID-19 that they have might be caused by a variant, we took the extra steps to get a sample of their virus and send it to a laboratory to characterize it. And sure enough, because of that gumshoe detective work, when we knew that we needed to go out and look for it if we were ever going to find it, we actually ended up finding it here. Now, we have been sending a lot of our samples for what is called genomic sequencing. That's different from the regular diagnostic test, the test that many of you have had, where you go somewhere and you get a sample from your nose or from the back of your throat that's sent for a really quick diagnosis. What we do in certain instances is take some of the positive results from that diagnostic testing and send it to a specialized lab to characterize the virus more fully. Indeed, right now, Maine ranks second in terms of all states, in terms of the percentages of our samples that we are sending for this detailed genomic analysis. We're sending as many as we can for as much analysis as we can. And again, right now, Maine ranks second, just a hair behind Hawaii in the percentage of samples that we are sending. Again, the bottom line here is that we found this because we were taking deliberate steps to look for it. Now, one of the more common questions that have come into us is, okay, I've heard about this variant, but is it more serious? Well, right now, public health experts and scientists are working to better understand the potential impact of this variant, including how it spreads, which is the epidemiological impact, and then how it affects people who are infected with it, which is the clinical impact. Based on what we know right now, this variant, the variant that we've identified in Maine, spreads more easily than the virus that we've seen already in Maine. This variant seems to be more contagious, and there are estimates that vary on just how much more contagious it is. Some estimates have the low point at about 20% more contagious. Some estimates have it at even 40 or 50% more contagious. That in and of itself raises concerns, which I'll talk about in a moment. But anything that is more contagious can lead to more cases, which overall may increase the number of people who need clinical care, such as hospitalization. But there are also new data that have just come out in the last 10 or 11 days, where scientists from the UK have started to study the clinical impact, not just the epidemiological impact of how contagious it is, but the individual clinical impact of this new variant compared to other variants. And the research that they reported suggested that this new variant may not just spread more easily, but rather if it infects somebody, that person may have more serious COVID-19 and may need to be hospitalized and may even have a higher rate of death. Another question that's come into us is whether the vaccines that we have work on this new variant. Based on the clinical data that we have available today, both of the vaccines that are currently authorized and in use in Maine, one by Pfizer, one by Moderna, are both effective against this variant. So what is Maine CDC doing about any of this? Well, we're doing a couple of things. The first, and as I mentioned earlier, we've been conducting genomic sequencing on a subset of the samples, the positive samples that we identify here in Maine, to see if we can find more cases of this variant from the UK, as well as other variants that we know are out there. Sadly, given how much this virus spreads and how easily these new variants can be transmitted, it is likely both that we will find more cases of this new variant, as well as other cases of other variants as well. One of the other things that we're doing, however, is working very closely with the individual in whom we have detected this variant to make sure they are abiding by all public health recommendations. Indeed, thus far, thankfully, they have. So we are hoping to limit the spread of this virus as much as we can so that it doesn't gain a foothold in Maine as it has done so in other states, namely like Florida. We're also working with the scientific community to study, for example, whether there are any impacts in the future of this variant on the overall health of Maine people, whether this variant leads to more hospitalizations, whether it leads to more severe illness, or sadly, if it might lead to more death. And finally, what does any of this mean for you? For those of you who are watching, all of this scientific information is certainly interesting, but what does it mean for you right now, here today? Do you need to change anything about what you're doing? For example, maybe wearing a double mask? Here's the bottom line there. Our recommendations, the bedrock principles that we've talked about for just about a year now, those recommendations for slowing the spread of COVID-19 still apply, even if we're talking about these new variants. These are things like wearing a mask, staying at least 6 feet apart from others, avoiding crowds, trying to ventilate indoor spaces, washing your hands as often as possible. Those bedrock public health principles that Maine people have abided in spades since our first cases. Those principles will also help prevent the spread of the garden variety COVID as well as these new variants. Before I turn it over to our colleagues in the media, one last question that I suspect will come up is, should I start double masking? Here's the bottom line there. The US CDC released a little bit of data yesterday showing that what really matters when it comes to wearing your mask is having a good fit. If there's air that can escape or you can inhale, the mask is not doing its purpose. There are many different ways you can improve the fit of your mask. One of them might be wearing a double mask. If you wear these surgical masks, the CDC noted that by putting a cloth mask over that, you can improve the fit. Another way is by potentially taking these ear straps and looping them a couple of times, again, to tighten the fit across your face. Whatever you need to do to make sure that your mask fits tightly, is covering not just your mouth, but also your nose and extending below your chin and is tight and snug across your face, that's what you should be doing right now. If that entails wearing 2 masks, not a problem. If that entails tightening your 1 mask, not a problem. In light of these new variants, now is the time to double down on common sense public health precautions. So with that, I'm going to turn things over to our colleagues in the media. The first question this afternoon goes to Patty White.
Thanks, Dr. Shah. Walmart and Sam's Club pharmacies are supposed to begin offering the vaccine tomorrow, but there have been issues with their website when people try to sign up. Do you know how many of the pharmacies are still on track to start? And do you have any concerns with the rollout so far?
Yep, Patty, I'm glad you raised that. I've been in contact, our team has been in direct contact with Walmart as recently as just before this, maybe 45 minutes ago, to check in on where this stands. Here's what we've been told by Walmart, which is that the overwhelming interest in seeking vaccination, not just among Maine people, but in the other states in which they are offering vaccines, caused some technical difficulties on their system. They are hoping to have those rectified based on what I was told by Walmart by 5:30 p.m. today. I personally have been checking the website to see when that is rectified. And when I haven't seen it, I've been sending emails asking for a timeline. We're going to continue to press Walmart to make sure that they get their website operational. They have told us that they are still on track for tomorrow. From what I understand, some individuals may have been able to schedule. But Patty, rest assured, and for everyone watching, rest assured, we are going to continue working with Walmart and pressing them to make sure that these technical difficulties are resolved as soon as possible.
And do you know if all of the locations are going to administer the vaccine? And also, do you have the ability to, divert doses if we get down the line, just as you did with the long-term care pharmacy program? If there are issues down the line, are you allowed to do that?
So as to the former, Patty, yes, all the Walmart locations in Maine, plus 2 of the Sam's Club's locations, will be offering vaccine. One note, you need not be a member of Sam's Club in order to take advantage of vaccination there. But all of those locations that have a pharmacy, which again is 22 Walmarts and 2 Sam's Clubs, will all be offering vaccine. Now, in terms of your question about the possibility to requisition doses and move them elsewhere, based on my understanding right now, that is not feasible. And that is because this allocation of vaccine comes directly from the federal government, as opposed to the long-term pharmacy program, which came out of the state's allocation and thus was something allocated to the state for our allocation and distribution. This, however, this supply to Walmart comes from a separate allocation directly from the federal government. My colleagues in other states have raised this exact question with the CDC. We haven't received a final answer on it. Rest assured, we will be, as we are with any recipient of vaccine, monitoring to make sure that what we give them matches what they are using in any given week. If we start to see mismatches there, again, you can rest assured I will be the first person on the phone with Walmart asking why they're not using all their doses.
Thank you.
Let me turn next to Chris Costa from News Center.
Hi, Dr. Shah. Thanks for taking our questions today. I have a couple here for you. Going to start with, we've talked about the effectiveness of different vaccines, and I guess it may relate slightly to the variants, but we've heard about different brands of the vaccine, manufactured by different companies, being certain percent effective. Can you explain what that means to the average person if a vaccine is 95 or 85% effective? What does that mean?
Okay, great question, Chris. So yeah, you're right. When we talk about vaccines, we talk about effectiveness. And the two vaccines that we've got that are currently authorized, one again by Pfizer, the other by Moderna, have shown 94 and 95% effectiveness. But effective at what? And compared to what? What does that even mean? So here's where that number comes from. In the clinical trials for both of these vaccines, they divided people into two groups. One group got the actual vaccine, and the other got a placebo. What they did was they followed people for the requisite number of months until there were enough cases of COVID-19 across both groups. That's what's it's called an endpoint-driven trial. They waited to a pre-specified statistically significant number of cases. And then when they reached that number of cases of COVID-19, they looked at the two groups, right? And they said, okay, in the group that got the placebo, there were 50 cases of COVID. And in the group that got the vaccine, there was 1 case of COVID. Overall, across the entire trial, there were 51 cases of COVID. But the likelihood of getting COVID in the vaccine arm of the trial was 98% lower in my hypothetical example. And that's where that effectiveness number comes from. It's effective compared to the placebo.
Gotcha. That's a big help. Thank you. Let's see. Question number 2 here. Wanted to ask you a little bit about the VAERS data, the adverse reactions, and how that's been going. Has the use of the system by staff at clinics, has it been effective so far? Have you guys learned anything from using that system so far?
We have, Chris, but let me qualify this or take a step back. What Chris is referring to is a national database operated by the CDC, an overall reporting mechanism where adverse events that may or may not be related to vaccines or vaccinations can be reported to the US CDC. And Maine, as well as all the other states, recommend, in fact, require that any practitioner, any clinician who's administering vaccine, report any type of adverse event, no matter what it is, and no matter if they know whether it's related to the vaccine. They are required to report that into VAERS. That's the name of this database. These types of databases are helpful for a number of things. The first of which is that it allows us to see whether there might be emerging concerns with the vaccines. The second thing, of course, is that it allows researchers to get a better sense of how prevalent those things are. And then the third is that it allows state level folks to know what's going on in our backyards. We look at those data from time to time to make sure that there is not a new signal that's coming out of the vaccine world in regards to the safety of these vaccines. Thankfully, there has not been, although there have been a few instances of allergic reactions reported to the vaccine. Beyond that, there haven't been new concerning signs of adverse events associated with the vaccine. So the system is working exactly as it should, and it's providing us the data we need in real time.
And just a quick follow-up on that, Dr. Shah. What's the procedure for if something doesn't get reported, or if there's something that falls through the cracks? How does that get corrected, or at least handled in the future?
Sure. This is the thing about clinicians, healthcare providers, is they are quite assiduous at wanting to make sure if something has happened with their patient, they are reporting it up through the right channels in this case to the US CDC. So we're not aware of systematic instances where there have been bona fide adverse reactions that haven't been reported. Is it theoretically possible? I suppose, but I'm not aware of a situation where there's been an actual bona fide adverse reaction that hasn't been reported on.
Gotcha. And then this is the last question. It's looking forward to the future. I think now that as we approach this kind of getting close to the 1 year mark of dealing with the pandemic, especially in our area, people I think are curious if they're going to have to continue to wear masks and social distance for many, many years to come, possibly forever, or are there certain benchmarks in the combination of factors, such as the number of people vaccinated, the potential decrease in new infections that could lighten some of these public health measures that we currently take to keep ourselves safe? And if it's the latter, are there certain specific benchmarks that allow us to start looking at lightening those guidelines?
Yep. Chris, there's a lot going on there with
Sorry.
that question. Indeed, there's multiple layers. And so I'm going to be uncharacteristically short, or I won't go into it too much, other than to say the following. We're optimistic that with the advent of two extremely effective, almost groundbreakingly effective vaccines, that given the widespread distribution, the robust uptake that we've seen in Maine, that the complexion of the pandemic may soon start to change. And that's, I think, the big picture. There are still concerning signs on the horizon, though, namely the introduction of these new variants. Now in Maine, they've also been detected in New Brunswick, Connecticut, Massachusetts. These new variants are, in effect, the wild card that raises questions about not whether we will be on that path to normalcy, but when we might get there. It's hard to predict, given those two forces. On one hand, a resoundingly effective vaccine. On the other hand, variants that are more contagious and potentially more serious, how those two things shake out. Again, there's so much more to be said about that. I remain an optimist at my core. And so I'm hopeful that we will be able to outrun the variants by out-vaccinating them. But the variants are a risk. We will certainly find more of them, and they could slow our progress toward that return to normalcy.
Thanks, Dr. Shah.
Mm-hmm. Let me turn now to Amy Brown. Hey, Amy.
There we go. Sorry about that. It wouldn't let me unmute. Can you give an update on the outbreaks at Tall Pines and Harbor Hill and Belfast, and whether the cases are among residents or staff, and maybe how far along in the process of getting everybody vaccinated those places are? How it's possible that they're having outbreaks when we're vaccinating people in long-term care facilities?
Sure. So let me start with Tall Pines. The case count at Tall Pines is at 9 individuals. I do have to issue a correction from an erratum from my Tuesday remarks. On Tuesday, I noted that the outbreak at Tall Pines was associated with the residential care. That was an error on my part. It is in fact associated with the nursing care side of Tall Pines. With respect to Harbor Hill, their case count remains at 7 cases. And Amy, in terms of their progress toward vaccination, you would have to ask them. I don't have a spreadsheet that lists every single person in Maine and what their percentages are in terms of by facility. You would have to check in with them to see where they are in terms of their progress in getting all of their residents and staff fully vaccinated.
Do you know the breakdown of those positive cases, whether they're staff or residents?
I can get that for you. It's buried somewhere deep in my notes, but I can get that for you.
Okay, thank you. And we've heard from family members and caretakers of children with Down syndrome, which has been found to be one of the high-risk medical conditions for COVID, asking if there's some way they could be included as healthcare providers and get vaccinated more quickly, since it's going to be a while before their children can, as part of the group that have medical conditions that put them at risk.
Yep, that concern's been raised to us as well. To me personally, indeed, just a couple of days ago, I wanted to make sure I was connecting with members of the DD community directly to hear about the impact that COVID has had on them and talk about the concerns that they've got, particularly around when and how they might be able to be vaccinated. We haven't made any final decisions on whether direct care providers or direct caretakers may be able to access vaccines sooner than others. Right now, we are still focused on those who are 70 and older, because even amongst those with other medical conditions, those who are 70 and older remain at a very, very elevated risk of death. So that's what our focus is right now. Where we go from here in terms of other categories, for example, parents and caretakers of those with Down syndrome and other developmental disabilities, we haven't made any final decisions on that.
Right. And does it look like the 65 and older group will start in March? I believe that's what was predicted.
No firm predictions there. We are still, again, only about a third of the way as of today through the 70 and older category. Now, we're not going to wait until we get to 100% to start moving to other groups, but at this time, we don't have a firm prediction.
Great. Thank you.
Yep. Let me turn now to Allison Ross.
Hi, Dr. Shah. Thanks so much for taking my question today. So just a few questions. Just to start, is there any update on the statewide website?
The registration website. That's what you're referring to.
Yes.
Yes. No update as of right now. We are still working to bring it online as quickly as we can. The focus amongst all of the various moving pieces is to start with a pre-registration site and then focus on a registration, validation, informed consent, and all the other pieces. But we're trying to bring on the pre-registration coupled with a call center as soon as possible. Many of you may have seen some reporting in the media last week around the site that was promised that we were supposed to be able to use from the US CDC, a site called VAMS, V-A-M-S. And you may have seen in that reporting, it came out of MIT, about how a number of states that initially had signed on to VAMS were now abandoning it in droves. We did not initially sign on to that because of early signs that we saw that were concerning to us. But as a result of not doing so, we and a number of other states, about 40 other states, are scrambling to put something together. We're hoping to have it out soon, though.
Okay, and then as you mentioned, this number, 175 new cases today, lowest we've seen since November, with no major holidays on the horizon. I know we have Valentine's Day, but no New Year's, no Thanksgiving. Are you feeling more hopeful right now?
You know, Allison, I'm of two minds right now, and that is sort of characteristic for the pandemic, right? The good news is always countermanded or counterbalanced by concerning news, and that's where I'm at today. Make no mistake, in the rearview mirror, some of our metrics like hospitalizations, case numbers, positivity rates, number of people on ventilators, all of those things that are lagging indicators telling us what was happening days, weeks ago with the pandemic, the rearview mirror, those are all positive. But at the same time, in the windshield right in front of us, we've got these new variants on the horizon. So my optimism is tempered by concern that that folks may let their guard down because of these improving metrics, which would allow space and room for the variant to run rampant. So I think I'm a little bit of both. I'm hopeful. I'm happy that we are seeing improvement, because in human terms, it means that fewer people are in the hospital, fewer people are on a ventilator, but I'm equally concerned by what we're seeing in front of us.
Okay, great. Thank you.
Mm-hmm. Let me turn to Joe Lawler next.
Yes, hi. I'm curious what you think, kind of piggybacking on the last question. Yes, we had no major holidays, but next week is school vacation week. And a popular trip for families is to go to Florida, go to Disney, et cetera. Do you have any specific messaging for people who are planning on doing that? And is there any extra public education for people coming back to the airports when they return? Or I'm just curious if you've thought about that.
Yep. It's a concern. And because variants are very much on my mind recently, I will note that the state right now with the highest percentage of new cases being attributable to variants is Florida. So travel of that nature, any type of travel in a pandemic is inherently something that carries some risk. And right now, given that these variants are circulating among other places quite widely well, I don't want to say widely, that's an overstatement of the case. The variants are more common in Florida than they are elsewhere in the United States. Travel of that nature carries a slightly heightened risk compared to travel, say, to another part of the country. My recommendation, my message to those folks is if you are traveling, it's a vacation, want to relax, I understand those things, but you simultaneously can't let down your guard. You'll be going to a part of the world, a part of the country where at baseline, there's just more COVID than there is in Maine. And then with more variants circulating, higher likelihood of getting infected. Don't let down your guard when you're traveling. Also, when you come back into the state, Governor Mills's travel requirements still apply. You must have a negative test upon reentry to Maine or quarantine for at least 10 days upon your reentry before you can go back into school. So that means if school starts back on Monday and you're not planning to get back until Sunday, that doesn't work. You've got to build in that time to come back, get tested, quarantine before you get your results to make sure you are not accidentally bringing COVID back with you from wherever you may be traveling.
All right, great, thanks. And my second question is, I'm wondering if there is going to be a greater role for the independent pharmacies in the coming weeks. There are some interesting trends I noticed. When I was looking at Walgreens, I noticed a week or two ago, they had 189 long-term care facilities on their lists. And when I looked today, it was down to 164. So does that mean that the state shifted some of those LTCs to independent pharmacies? But at the same time, I noticed that for next week, the allocation for independent pharmacies was only 400 doses. So I'm just wondering if you could give us an update on what's happening with that.
Okay, good. Really important caveat, Joe. And I commend you for scrutinizing our data. Really important caveat, though. The allocation that we publish is just first doses. So independent pharmacies, we have been working with them, and I am so proud of the partnership we've developed. We have tapped into them as fully as we can. The reason they're not getting much next week in terms of new doses is because they have been fully committed up until now and are now starting on second doses. Those second doses generally appear as a matter of course, and so we don't put them on our spreadsheet because you have to be a CPA to keep track of all of those things. So very important caveat, if you see, for example, that a certain group of people aren't getting much this week, but lo and behold, they got a lot 3 weeks ago, it's almost invariably because they are now focused on second dose clinics. So that's what's going on with independent pharmacies. But generally speaking, in fact, yesterday I had the chance to speak with and meet with the Pharmacy Association to discuss, generally speaking, where we go from here. And they have signaled their interest in continuing to work with us to provide vaccines and vaccinations, among other places, to long-term care facilities and assisted living, but to a wider array of facilities as well. So we anticipate working with them more and more as we move through our process.
Can you explain, though, why there's fewer Walgreens LTCs?
Yep. It's largely for the reason you noted, Joe, that we have tried to load balance across the state. And so if Walgreens or CVS had additional facilities that they weren't able to get to on the timeline we wanted, we found other folks who could provide vaccinations for them. In this case, yes, independent pharmacies. I can't confirm that the exact number is 25, but directionally speaking, that's what's going on. Let me turn now to Jessica Piper next.
Thank you, Dr. Shah. First, I wanted to ask, a couple of weeks ago, we heard from you about these 1,400 vaccines that were put on hold because there were temperature issues. I was wondering if it was resolved, whether those were like bonus vaccines or if Maine's got less on an order in the past couple weeks because of that. And also, can you say where those vaccines were sent once they were determined to be okay?
Sure. So Jessica, they were cleared by Moderna for use. They were found to be perfectly fine. Indeed, the temperature excursion that had happened was that they were too cold, not that they were too warm. Thankfully, for a vaccine of this nature, being too cold does not harm the efficacy of the vaccine. I think we announced that, I want to say 2 weeks ago, that these vaccines had been cleared for use. I do recall announcing it at a briefing, so that piece should not be news. Those vaccines, however, we received replacement doses as soon as we detected that there was a temperature incursion. Operation Warp Speed sent us 4,400 replacement doses. We received second doses. Oh, this is going to be, okay, buckle up. We got second doses for the frozen doses that we got on the normal schedule. But because it took 2 weeks for Moderna to determine that the frozen doses were in fact viable, once those started being utilized, we had to figure out a way to provide for the second doses for those frozen doses. Those second doses came out of this week's allocation of first doses of Moderna. So I'm going to stop there. Does that add up?
Yeah, I think that does.
Okay. So basically we got 4,400 extra doses, first doses. That's all great. But Warp Speed said, and CDC said, it's on us to figure out where those second doses are going to come from. And that's what we had to do this week.
Thanks. And then I wanted to address, you talked a little bit about the testing for this variant. And I was just wondering if there's anything about the way Maine or external labs are testing for variants is going to change now that we know this UK variant has been confirmed here. If there's like testing that's going to try to determine, how prevalent it gets in the next couple of months.
Well, very important to bear in mind, Jessica, that Maine was already in the vanguard in terms of the percentage of samples that we were sending for this specific genomic analysis. Again, we were just a hair behind Hawaii, leading the other 50 states in terms of how many of our positive results that we were taking steps to characterize and sequence so that we were keeping vigilance for these variants long before they first were found in Maine. We're looking, however, given that we know these variants could explode, we're looking to ramp up how much of that specialized testing we do. We're doing so in a couple ways. Number one is we've already been working with our colleagues at the Jackson Laboratory. They've been partners with us since the first days of the pandemic. They've been helping us do much of this genetic sequencing. That is one reason why Maine, again, is in the vanguard in terms of the percentage of samples that we test. It's because of that partnership. The other thing we're doing is working more closely with the US CDC to send more samples there. But we're not going to stop. We're also going to bring the capacity to do this very, very technical sequencing. We're going to bring it in-house to our own laboratory here in Augusta so that in urgent situations, we can run that type of genetic analysis at our own laboratory. It's very intensive. It takes days for the testing as well as the computation on the back end of the computer analysis. It takes a long time for that to be done. It's not like these rapid tests where we can do 1,000 or 2,000 a day. It's a very intensive process, but we're going to bring that capacity on so we can do as much of it as we can in Maine.
All right, thank you.
Mm-hmm. Let me turn it over to Evan at the Maine Beacon next.
Hi, Dr. Shah, thank you. So on the state's vaccination dashboard, there's still a fair amount of people whose race and ethnicity has not been provided to Maine CDC. And I'm wondering, maybe this is a hard question to answer since that data has not been provided, but can you shed on any light or do you have any sense of what some of the demographic leanings of that group of people might be?
Evan, it's a good question. It's one I've discussed with our team. Unfortunately, I don't. There are two reasons that we've spotlighted why those data are not regularly and consistently provided. One of which is that individuals at the point of vaccination may decline to reveal or disclose or report their race or ethnicity. The other is that providers being quite busy trying to vaccinate as many people as possible may not necessarily ask in each and every instance. And indeed, as a fraction of all of the vaccinations done, what you see is that there are a concerning number, a concerning percentage, where we don't have clear insight into the race or ethnicity of the person who was vaccinated. We've tried to hypothesize or model, based on where folks are getting vaccinated, what their race or ethnicity might be. The bottom line, Evan, is that we don't really have good insight into that. There are too many variables, and any estimates we would come to would have way too many limitations to be useful for any purposes. So unfortunately, I don't have much light to shed on that.
Mm-hmm. And just going off of that, so with that kind of the data that's not been provided on races and ethnicity, is it at all possible to determine whether there's any sort of racial disparity in Maine's vaccination rollout?
It's very difficult. I think we can hypothesize based on the data that we do have, but without knowing that negative case, without knowing what we don't know, it's very difficult to come to useful, actionable conclusions. So this, I think, just underscores the need for folks who are being vaccinated to feel comfortable talking about disclosing, reporting their race or ethnicity. We use these data so that we can help avoid disparities. We're not using it for any other purpose other than to try to rectify disparities that we are deeply concerned about, that we fear will emerge. This is not about tracking individuals. It's about tracking populations so that we can avoid these disparities materializing.
Great. And just one last question. So on another topic, with the reports that have come out about Maine Health and its vaccination of those who aren't directly working with patients, is Maine CDC planning to or already having discussions with other hospitals to make sure that this isn't happening, that they're following the rules set up around vaccination?
Yep. So, Evan, I think it's important to note we're always having those conversations. We're always checking in with hospitals about what their supply of vaccine is, who they're vaccinating, how many folks they've got scheduled, the extent to which they have questions about the governor's prioritization system, and those who the governor has opted to vaccinate, focusing on the highest risk people in Maine. We're always having those conversations. We've been having them from the very first days, and we're continuing to have them now.
Great, thank you.
Let me turn now to Morgan from WABI.
Hi, Dr. Shah. Thank you for taking my questions today. So you mentioned earlier the 65 and over group. A week ago, Commissioner Lambrou said for the next month, we should have enough supply to get through 2/3 of people age 70 and over by that first week in March. By the time we get to that first week in March, we hope to be able to begin the 65 to 69-year-old population. I ask this also because we've heard from several viewers who are in the one in particular who is 69 years old. Her husband is in the 70 and over group. She's facing major serious medical issues, and she's wondering when she might be able to get the vaccination.
I'm hopeful that we will be able to move toward that 65 and over category sometime soon. We're making good progress thanks to the work of so many healthcare providers, as well as those 70 and over in Maine who themselves have been eager to be vaccinated. So we're making good progress. All that being said, Morgan, as of this morning, we're only at about 1/3 of the way. Commissioner Lambrou is right. Based on the vaccine supply that we are receiving, we hope to be at least halfway through. And that will open up the possibility of projecting when we might be able to open those doors up to the 65 and over category. We don't want to do so too soon because we don't want to crowd out the need for example, 70-year-olds who have received their first dose to not be able to get an appointment for their second dose. So we have to balance when we open that door to make sure we allow time for folks to pre-register, but also not simultaneously crowd out those who are angling and need to get their second dose. It's going to be a bit of a balance. There have been some changes in the data and in terms of administration rates just in the recent days. So I don't have a forecast for when that might be, but we are looking at it really, really closely so we can try to project out and give folks as much time as possible to start preparing for making an appointment.
A quick follow-up to that, do you predict that you may be able to begin that group even if the 70 and older group is not completed?
Yes. So as with all things with vaccination, it is not a discrete light switch. It's not either on or off. It will be a dial. And as we've done with moving from 1A to 1B, we will turn up the dial on those 65 and over as those 70 and over are wrapping up with their vaccination. We will not wait until the very last person, 70 and over in Maine, has been fully vaccinated before we open up to 65 and over. We'll be turning those dials gradually. When we start turning up the dial on those 65 and over, we really need to get a little bit more data and a little bit more runway ahead of us before we can start making those forecasts.
Okay, thank you. And then my second question is, I actually asked you this question a little ways back about that second dose of the vaccine and taking the day off after that. Is there any more data surrounding that? Because I'm hearing from, and we're hearing here that there are people who are taking the second day off because of their coworkers who have been really knocked down with flu symptoms that second day. And I'm hearing that the younger they are, the harder they're being hit with these flu-like symptoms, body aches, the second day.
Morgan, if I may, based on that I've seen, I do wonder whether you are just hearing the worst of the because based on some of the data that I've seen, although folks do have a slightly stronger reaction after the second dose, that's by design. That's your body's immune system saying, we're ready to deal with this the next time we see it. It hasn't been so widespread or debilitating as to cause systematically people needing to take a day off. It's been reported. I suspect that what comes to your desk is the very tip of the iceberg, the worst of the worst. Based on the data that we've seen or that I've seen, it does happen, but again, not so widespread or systematic as to be a problem for the labor market or for hospitals or long-term care facilities.
This is from a healthcare facility. One instance is a local healthcare facility who had 8 people out day 2. And I've also heard people, social media contacts I have across the country as well.
It can certainly happen, but given the given the now regularly 3, 4, 5,000 people in Maine every day who are getting a second dose, we're not seeing reports of hundreds or thousands of people across the state needing to be out. It does happen on a small percentage basis, but again, not so widespread as to cause disruptions in healthcare facilities or to dissuade people from getting that second dose. What healthcare facilities have done and should do is to stagger their staff so that even if a small percentage of them need to be out after their second dose, that doesn't put the rest of the facility in jeopardy. Let me turn to Dustin at New England Cable News.
Hi, Dr. Shah. 2 questions, both on the variant. The second one will probably be your favorite one. In terms of the first one, though, is there more concern if the UK variant of COVID-19 spreads quickly in sparsely populated areas of Maine as opposed to a more densely populated area with more hospital capacity?
Okay. Yes. I mean, the answer, generally speaking, Dustin, is yes. I'm concerned, of course, with any transmission of any of these new variants, but given the relative fragility of rural parts of Maine, less healthcare capacity, so on and so forth, not just when it comes to COVID, but almost any other health condition. I'm particularly concerned as in a rural area, but in this case, I think right now for where we are, I'm concerned about any transmission in the state.
And now the second question, I just wrapped up a Zoom call with Jackson Lab about the COVID-19 variant sequencing work that they've been doing with Maine CDC. They also talked about how we're one of the top states for sequencing, which you spoke about. Can you talk about that a bit more? And is there anything unique about Maine's sequencing capability?
You're right. You were correct, Dustin. So we've worked with Jackson. I mean, I think even before we had our very first case, or around that same time, we were having conversations with Jackson Labs about all things COVID. Dr. Liu and I have had numerous meetings and discussions, whether it's around testing, strategies for control. Dr. Liu himself worked in depth and in detail in Singapore during the SARS epidemic in the early 2000s, at a time when I too happened to be working in Southeast Asia and Cambodia. So he and I both got our start in another pandemic or another worldwide epidemic. And so from that time on, we worked with them on whether it's testing, whether it's strategies for control. And then later on, when the need to have a better grip on the sequencing piece came into focus, we started working with them because of their detailed and strong bench when it comes to sequencing. So one of the things that has been able to allow Maine to set ourselves apart is that partnership in and of itself. The other is, and if I may be just a little immodest on this one, we saw this coming. Around the time when these variants were first being described as raising concern. So there are always variants of any virus. There's hundreds upon hundreds of them. But in December, when we first started to see these so-called variants of concern emerge, that's when we really started working to ramp up the components of our sequencing. Dustin, very important, we were sequencing samples before there was ever any talk of the UK or South Africa or Brazilian variants, but we've amped it up even more so since then.
So that's what's unique, the amount of time we've been doing this relative to the amount of variants that are out there.
It's that is part of it. I'll be even a little bit more. I'll commend my team here. It's planning, right? I mean, I think what has set Maine apart from so many other facets throughout the pandemic. We planned to do things before they happened because we saw them unfolding in other places. We saw this concern unfold in other places, and so we started planning around sequencing long before it became a thing that was an imperative. We were already in a rhythm of doing it, which means that we can ramp it up so much more quickly. Having our colleagues at Jackson in our backyard helps that even more so. Let me turn it over to Patrick Whittle next.
Thank you very much, and happy Thursday. I have a question. I have a couple of questions. One comes from a reader. The CDC put out some guidance this week. The U.S. CDC put out some guidance this week that folks who have been fully vaccinated against coronavirus don't need to follow quarantine protocols. And I'm curious, and the reader is curious, if this is going to trickle down to the state level, and does Maine have any sort of state-specific advice about this for folks who have had the shots here?
Yep. So Patrick, if I may pick up on the same theme from Dustin's question, we knew this was coming at us, and based on the data that we saw around the efficacy of vaccines, we didn't wait for the US CDC. We actually announced this change over a week ago. You can find those documents on our website. If you Google Maine CDC Health Alert, we announced to clinicians who are really the ones counseling patients on these things. We announced to clinicians over a week ago that a patient who is fully vaccinated, so 14 days after their second dose, if they are exposed to somebody with a confirmed case of COVID, someone who's been fully vaccinated does not need to quarantine. They are welcome to, of course, for an extra measure of safety, but the vaccines are so effective that quarantine is not necessary. So we went ahead and announced this based on my review of all the scientific data around these vaccines. We made this announcement, I think it was the 9th, but you can find all that on our website. We communicated that out to healthcare providers and physicians and health officials over a week ago. We weren't waiting for the CDC on this one.
Okay, good to know that. Switching gears a little bit, another local government, Androscoggin County has sort of voiced some concerns about mask orders and other things coming from the constitutionality of mask orders and other directives that are coming from the state level. And in so doing, they put out some advice that runs counter to what the U.S. and the Maine CDC have been saying all along about masks and avoiding transmission of coronavirus. I guess what I would love to know is if there's any role for the State Department of Public Health or the state CDC regarding these local governments that do this, because this is sort of the second county level authority that has done this in the face of what everyone is hearing from the state.
Yeah, Patrick, I'm familiar with that as well. I think as to the sort of lines of authority element of your question, I think I'd refer you to the governor's office for a more detailed discussion around that. What I will say in general, however, is that the science of masks and masking and the effectiveness that they have at reducing the transmission of COVID-19, that is now at the level of certitude that you find with just a small number of things in science. It's rare that you find so many studies all establishing and pointing to the same efficacy and conclusions. Really, the discussion around masking right now is at the margins, literally how to make your mask fit better, not whether they work anymore. The conversation has moved on from whether masking is useful to now how to make it even more useful. That's where I'd recommend folks talk about these days.
Okay, yeah, appreciate that. And if I could sneak in one final thing,
Mm-hmm.
The state of Massachusetts has started allowing folks who sort of act as transportation for friends or family members who are eligible for a vaccine to also get a vaccine. I'm curious if the state of Maine is considering doing anything like that as well, given that we do have a population with a lot of advanced age. And this is sort of, I think the reason the state of Massachusetts is doing this is to make it easier for caregivers and loved ones to get older folks to clinics.
Yep, Patrick, I am aware of the change that they made. I have much to say about it, but what I will say is at this time we do not have any such plans to go in that direction. We don't have any current plans to do so here in Maine.
Okay, roger that.
Mm-hmm. I want to just note one really important element, Patrick. If I could go back to your first question on the quarantine guidance, I wanted to just emphasize one really important thing. Maine CDC issued guidance around individuals who have been fully vaccinated and them not needing to quarantine if they've been exposed to somebody with COVID-19. The guidance, however, on needing to quarantine if you are coming into Maine from a non-exempt state, that has not changed. So if you are, going back to Joe's question, going down to Florida with your family, and everyone in the family has been fully vaccinated, you still need to quarantine or test when you return to Maine. We are still evaluating that element of the guidance right now, and it has not changed as of right now. So I just wanted to make that perfectly clear for everyone watching. Yep, thanks, Patrick. The last question for the afternoon goes to Brad Rogers.
I forgot to unmute myself there. Just curious, I don't know if someone's asked this already in the previous day, but how is the person with the COVID variant doing? How's his health, and did his family also get the variant at all? What can you tell us about that?
Sure, Brad. I don't. As you know, I don't generally comment almost at all on individual cases. But given the heightened interest on this, what I will say is our team has been in contact with the individual. The individual is doing well. And in this instance, again, given the heightened public concern, I don't mind sharing, or we said this in our release yesterday, that members of this individual's household, some segment of the members of the household have also got COVID as well. They too are doing okay, and the entire family unit is isolating. They are not having any contact with others. So thankfully, everyone is doing okay. So very good. Thanks, Brad. Well, I just want to wrap up to just summarize where we are. As I mentioned in connection with Allison Ross's question, in our rearview mirror, some of the signs that we track every day from an epidemiological perspective are looking good. That's encouraging. Positivity rates, hospitalizations, ICU bed occupancy, and thankfully even deaths have all come down. That's encouraging. But in front of us, right outside of our windshield, we have concerns around things like the variant. And then happening all around us are vaccines and vaccinations. Where we land on all of this ultimately will be a function of whether we can keep up the good public health practices that we've all collectively developed as a state, as well as continuing to move forward, building on the momentum that we've gained to keep vaccinating as quickly as we can. If we can keep up our guard, keep up our masks, and keep vaccinating, my hope is that we can outrun the variants and be back squarely on that return to normalcy as quickly as possible. I'd like to thank everyone for your time this afternoon. I appreciate you tuning in. As always, please be kind, take care of one another. We will talk again next week.